if you can notice that shift in your own nervous system while listening to something that we speak in this episode, it's definitely a reminder that there's something in your own family climate, in your own story, that you need to pause and probably look at or reflect on and then do the need.
It's the qualification and the experience. Yeah. And I think if you have a combination of those in a human that cares, we can make a big difference. And I think that we're seeing those differences little by little. By coming together as a community, we'll see bigger differences. So I think that something we can think about is, what do we do?
Personally, I believe the ones who come to therapy, more than them, their families, their workplaces, the people they interact with, actually need real help and real insights, because that's how.
But it's very hard when something's happening and say, oh, I made a mistake here, or I enabled that. Yeah. And a lot of times when that enabling happens, it's not intentional.
Yes.
There was no intention to harm their child or to make them anxious or go into a depression or any such thing. It's very hard.
And you do this so beautifully, because this reminds me of my parenting, my own kid. Like my firstborn and my secondborn, I see such a huge difference.
Yes.
And I'm sure most mothers will
Yes.
relate to this, whether you are a psychologist, you're just a mom.
Addiction. They feel that they need it. If they don't have it, they don't know how to cope, they don't know how to help themselves.
Yes.
The physiological addiction is when I give a medication or any person takes a medication, it means that their biology, their brains, need it to function. And will always need it to function. Sometimes we need that to balance out things in our brain, and now we're on the same page. Nothing is 100%, but it's beautiful to see that connection.
Yeah. And what's flashing across my mind is all these stories that you're talking of. See, that reconnection is such an amazing thing.
Yeah, work.
Quick fixes don't work.
Right.
Shortcuts don't work.
They don't.
So even with therapy, again, you have to, so what is therapy? Therapy is also about enabling or allowing people to learn to sit with their discomfort, is how I put it, in a safe container.
Yeah.
With the dynamics.
Yes, absolutely, and work with their strengths.
And work with their strengths.
A lot of times they don't recognize the strengths. They're coming in feeling deflated.
There's
They're coming
no
in feeling
acknowledgement.
hopeless. Yes, when they're very powerful and they have a lot of assets that they just haven't used yet. They don't know how to enable themselves.
Yes.
So understanding that they're doing the best they can with what they have, understanding that they're trying to do what they think is right. And for some kids, they actually need that kind of protection because they are impulsive, they can be very dangerous to themselves, and they may need that.
Yes.
For other kids, they don't need that. And it's not because we want to shame or blame or any such thing.
Yeah.
We want to understand where these things came from.
Yes.
Good intentions can still lead to poor outcomes.
Yes, yes. And the intention is to solve what you're struggling with right now.
And if we hold them on this pedestal, it's also, as you were saying, very difficult for them.
Very difficult for the
to
parents.
ask for help.
Yes. Yes. How do you define respect? What do you think when it comes to, let's talk about today, how would you tell a teen that, okay, this is respect for parents?
So helping them really genuinely understand that they've really been successful, and these are the challenges of their success, helps the parents a little bit relax and understand that this is a new generation that we're challenging, and we're challenging them to, is 3 generations.
Welcome to this episode of Ask Rahat, the Healing Edit. Now, this podcast is raw, unfiltered conversations that stem from experience and a lot of qualification, learning, and a community work, I would say. So today's guest, Dr. Sarah Bougary, she has community work at the heart of it, okay? So that's one reason or one common thing that we both share, and I've invited her to speak on a very important topic on how family dynamics fuel anxiety. So there's a lot that we're going to be discussing in this podcast, and we welcome you to this forum of probably understanding your own patterns, introspecting, and if the conversation feels uncomfortable for you in any way, if you can notice that shift in your own nervous system while listening to something that we speak in this episode, it's definitely a reminder that there's something in your own family climate, in your own story, that you need to pause and probably look at or reflect on and then do the needful. So Ask Rahat is a space where we are like engaging different experts and I can say heroes in their own field. This first season is all about psychiatrists coming here, exceptional psychiatrists. When I say exceptional, it's not just the qualification, it's not just the it's not just the kind of universities that they went through. I call them here because I have seen the work that they do, the space that they provide, and their approach, and the humanness that they have, the ethical principles that are core of their practice. I have with me Dr. Sarah Bougary, and I welcome her to this amazing session, and I'm so looking forward to talk to you.
Thank you. I appreciate that.
And not just this, Dr. Sarah is a psychiatrist, and you also practice therapy, right?
Yes.
She also practiced therapy and children, adolescents, all of this. She's the founder of the Monarch Centers here.
Yes.
And also importantly, the founder of Menata.
Co-founder, yes.
Co-founder of Menata, and she's going to be telling a little more about yourself if you can begin with.
Sure. So thank you. I really appreciate this opportunity, and I think that it's absolutely 100% that as long as we're looking at the community, we'll see some successful stories there. And I think it's important to recognize that there's two things, and I really appreciate that you mentioned both. It's the qualification and the experience.
Yeah.
And I think if you have a combination of those in a human that cares, we can make a big difference. And I think that we're seeing those differences little by little. By coming together as a community, we'll see bigger differences. So I think that something we can think about is, what do we do? How do we activate people? How do we look for allies within the community? Instead of coming into the community and just saying, this is what you should do, we should be humble enough to learn from the communities that we think we want to help and actually understand if they want our help and what kind of help they're looking for. And I think that's both. That was my ethos when starting a Monarch and when I was discussing co-founding. So I think that it's important for me to really understand the person that's in front of me. And when we think of a person, we think of a family unit. That family could be blood relatives. It could be their really close friends. We don't know. But looking at that as the baby community and then expanding upon that. So at Monarch, we do that. We try to make sure that as much as we can, that we look at the person plus their supports their community. At Menata, you're part of that community, which I really appreciate. You're the first one to say yes. Put your hand up and come into Menata.
I have to.
First one, that was beautiful. So I really appreciate that. And that's what we do. That's what Menata is. It's not recreating anything. It's people are already doing great work. So respecting that work and just connecting a little bit more and building on it.
Amazing.
Thank you.
What you just mentioned is the family as a unit, and today's topic is how family systems fuel anxiety. And I think when we see children, when we see adults on the couch, or let's say it's not just here, I've been working here for the last 3 to 4 years, but back home in India and working online with international clients, with the local community, there is one common pattern and one common thread. And I think we miss that. When we have a client in our rooms, we often just look at the client. When I'm saying we, it is a generic thing.
The global
way,
we.
The way the society perceives, the way the medical community also perceives, okay, this person has these issues, but when I scratch the surface, or when you scratch the surface, it's not the person sitting there who needs help. Personally, I believe the ones who come to therapy more than them, their families, their workplaces, the people they interact with, actually need real help and real insights, because that's how I see people. And today we're discussing this when families fuel anxiety. So my very first question to you would be, Dr. Sarah, so when you have children coming to you, because you deal with children as well, right?
Yes, children, adolescents, and adults.
Adolescents and adults, of
the
course.
family range.
Yeah, let's begin with the children, because I want this talk more to be reaching out to these parents who are watching us, whose kids are young, and who can perhaps do a lot of preventative actions that can help them.
Absolutely.
So when we have kids walking in for any reason, it can be school anxiety, it can be bullying, it can be any concern that they come with. Now, I want to understand what is your experience saying, how much is the family dynamic an important factor or an enabler of the anxiety
Sure.
or of the depression or of any concern that the child is feeling.
Sure. And I think it's important to look at both sides. So if we think about enabling any kind of mental health challenges, families are more likely to take credit when the child is doing well and say, yeah, I raised them well. But it's very hard when something's happening and say, oh, I made a mistake here, or I enabled that. And a lot of times when that enabling happens, it's not intentional.
Yes.
There was no intention to harm their child or to make them anxious or go into a depression or any such thing. And we have to think about backing up a little bit and holding space for the families that they sometimes come in with some guilt and some anxiety themselves. And if we think about it, we just have to, it's simple, but it's not simple. It's psychoeducation. That's the basis of anything that we do. We have to get on the same page with the person that we're talking to. So we talk about something called a two-hit theory, which means that genetically, some children are more predisposed to depression, mood disorders in general, but depression, anxiety, bipolar, any kind of disorder, there's some sort of genetic predisposition. So the DNA with the building blocks of our bodies have this.
Yeah.
We used to think of it as a weakness, now we think of it as it's just there. It's not something that we have to, we accept it. People are different, and people that are anxious a lot of times are very high IQ. People that are depressed are a lot more sensitive. We're starting to see some nuances there. Starting by destigmatizing the idea that having anxiety or depression or schizophrenia or any kind of mood disorders or any kind of mental health disorders is bad. It's not bad or good, it just is.
It is, yeah.
Right? Then we start to talk. We look at the family patterns. We look at what's happening because a lot of times the families that are bringing their children in want help. So they're already saying something's different, we need assistance. Then we look at what are these patterns that we see. We look at, for example, simple ones when they're very young. They're climbing up ladders or they're playing on the playground. Be careful, don't get hurt. Good intentions.
Yes.
Very good intentions.
That just comes in.
It can come across, and the confusion happens when you tell the same thing to two different children in the same family, even siblings. Two kids will go up, be careful, don't get hurt, be careful, don't get hurt. One will get anxiety, one won't. And as a family, you think I'm teaching the same thing. I treated them equally. Equal isn't equitable. Each child
This is very important, that equal is not
is not equitable. Yeah.
I think that's a very important message.
And it's hard to give, and it's hard to receive, because we think we want to be fair.
Yeah.
But what's fair doesn't mean that it has to be the exact same thing. So the personalities of our children are different. The temperament of our children are different. Even the inheritance that we give them is different because it mixes.
Yeah.
So knowing that this is unique is important.
Yeah.
So we want to keep our kids safe. We want to try to get them to be smart about things, but we have to also enable them.
Yeah.
It's called measured risk-taking. So if my child says, I want to go up to the second floor and try to jump, it's a no. There's risk there, but it's not acceptable. They want to go and they want to play on the monkey bars that are super high. It makes us anxious because probably our mothers or our grandmothers or somebody was anxious. We have to sit with our anxiety. It's very hard.
And you do this so beautifully, because this reminds me of my parenting, my own kid. Like my firstborn and my secondborn, I see such a huge difference.
Yes.
And I'm sure most mothers will
Yes.
relate to this, whether you are a psychologist, you're just a mom, any profession, you will relate to this, that the first child, I think the anxiety, the level of anxiety is always higher in the parents because you have
Right.
the best intentions in place.
Yes.
And I see a huge difference in the personalities as well of my
Yes,
kids,
of course.
Of course. And as a mother, I see that today I am with my second child, with what I've learned with my first one, it's more about sitting with my own discomfort.
Mm.
And I think I need to learn that as a parent is something that all of us need to. So with my parenting programs, I keep telling yes, we need to learn to sit
Mhm.
with our own discomfort,
Yes.
tolerate it,
Yeah.
and see
Yes.
how it goes.
And it's difficult, right? Because it's one of the hardest things we'll ever do. As if we look at just sitting with parents and thinking about all the things that the children reflect back to them,
Yes.
and they have to relearn, they have to,
Yes, and themselves.
so they can parent
Yes.
their children. It's
Right.
quite a challenge.
As a psychiatrist, I want our audiences to know from you, what are the symptoms of anxiety that children, how do they look like?
It's variable, which makes it very difficult, to be
Yes.
honest. So the temperament is important. The personality of the child is different from person to person. The age is different. The intellect is different. The way that the family receives things are different. So any change in the natural, normal, if you will, behaviors or interactions of a child we start to think, are we missing something? Should we look at this? And should we look at this does not mean that there's a disorder or a diagnosis or something's wrong. It just means, is there something different? Do they need a different kind of support? Typically with anxiety, we'll see refusal, we'll see withdrawal. Sometimes we can see aggression. Sometimes we can see acting out, throwing things, not because they're trying to be mean or nasty or upset us as parents, but because they don't know what else to do. They don't have the language if they're younger. And if they don't have the language to express, they can't tell us. And a lot of times they don't know what they're feeling. It's just this irritability.
The tantrums
So it ranges from child to adult. But a lot of times it's withdrawal. It's going away from things.
Going away from things.
From school, from family, from anything they used to participate in, they pull away.
Yeah. That's very important. Why am I asking this question is because I have observed this trend. Even when parents come to me, they Google it, they search it. Of course, now they talk to ChatGPT or any other AI-assisted model, and then the parents are so hyper in terms of my child. They give me the diagnosis. My child has anxiety. My child has OCD. You know what, he's behaving like this. Well, when we sit, and the way you said, the uniqueness, and this is what we want our audiences to understand, that every person is different.
Yes.
Even when they're raised in the same environment, even identical twins for that matter, right?
Yes.
What we are saying is backed by scientific evidence. It's just that we are saying because we're seeing it in our clinics. And this tendency of parents to jump the queue and decide for themselves and then hold that. And I don't know if you've come across this experience when I sit with parents and when I say, no, it's not anxiety, it's something else that's bothering the child. And maybe it's the control in the environment, it's the perfectionism that the parents are seeking. It can be various things in that moment. And they deny to accept it because they think, no, we've searched the internet, these are the symptoms. What would you like to tell parents in terms of how the media is also influencing a lot? Like, especially the Instagram reels that go 1, 2, 3, 4, 5, 6, TikTok, and that's having a mass influence in the way parents are observing their kids, I would say, in some ways.
I try as much as I can to frame it in a positive light. So a lot of times if they're very adamant about something and they come in and they have a diagnosis with the list of symptoms, and you'll see that sometimes, they have the list of symptoms and they'll tell you what your differential is, and they'll tell you why they chose that diagnosis, and then sometimes they'll actually have the medication because I can prescribe medications.
Yes.
So they're coming to me to say, do we need this medication, do we need a different one, in addition to therapy. And so if we're already at that point, my question to them is, what are you asking of me?
Yeah.
So I don't want to fight it. Because
same.
they've already made their change. They've already made their decisions.
Minds,
They're there. How can I help? And a lot of times that's very disarming. Because what do you mean, how can you help? We're coming to you so you can tell us the medication. And sometimes they'll just come because they want a prescription. And literally they'll tell me that.
Yes.
So I'll say, okay, if I write this prescription today and you go ahead and you take this prescription, you go home, what are your expectations of the medication? What do you hope to see? And then they start to think. And then they start to examine what they're expecting. So it's called rolling with resistance. And explore with them. And many times I get a lot of tears because there's a lot of hope attached to this one little pill that's going to fix everything.
Fix everything. And there's so much of, you can say, I also see that concern at times.
Yes.
There's this huge concern of, oh my God. And they're trying to process what little piece of information they have, and then they're trying to connect the dots with the child's behavior. And that's very taxing and stressful for parents. And
it is.
Yeah. And as therapists, as psychologists, like we can't just prescribe medication and then they say no, we want the referral of a psychiatrist. We want to have this. And then there are some who need the medication.
Yes.
And then there is the resistance,
the
denial. You have this as well.
Yes, I have both.
You have both.
It's a range, so it's coming in with a prescription and sometimes even with the dose, and they just say, just write it.
Just write it.
Let's talk. Sometimes they'll come in and they absolutely, literally will come in. The first thing they'll say is, we're not walking out of here with a medication. So I respect that. That day, we're not walking out with a medication. Then we have to explore where that comes from. They've come for help, but they don't know what help they want, but they know that medicine is a no-no. And sometimes medicine isn't indicated. And if it's not indicated, that's okay. If we can fix this in a different way, let's do that. Why not? So my responsibility towards anybody coming into the clinic is helping them understand where they're at, and then helping myself understand what they need and come to a conclusion. So with that comes this stigma that's associated with medication. One of the common ones is they're going to become an addict. It's the opposite. When their biological needs and their emotional needs are not met, they might seek substances. If they need medication and it's indicated, especially with children, it's a short term. It's nothing that we think, okay, we're going to start a medication, they'll stay on it for the rest of their life. It's nothing. It should never be something that's addictive for children, even with adults. Even with my adults, when they come in and we're thinking about something called an SSRI, selective serotonin reuptake inhibitors, an antidepressant, anti-anxiety, it helps with OCD, many uses for it. It's not addictive. We have to come off it gradually.
Can you say that one more time, that it's not addictive?
It's not addictive. I promise, it's not addictive. And when we talk about addiction, one of the two things we have to talk about is the biological addiction and a psychological addiction. And so that's why we have to choose wisely when we're choosing the different medications for our patients. Is this a person that's going to think, I'll take a medication, everything will be good, and I'm done?
I'm done, yeah.
Because then there's a psychological addiction. They feel that they need it. If they don't have it, they don't know how to cope, they don't know how to help themselves.
Yes.
The physiological addiction is when I give a medication or any person takes a medication, it means that their biology, their brains, need it to function and will always need it to function. Sometimes we need that to balance out things in our brain. We have different receptors and different proteins and fats in our brain that work together to help us be even-keeled. Sometimes that never comes back to what's normal so that they can live their life. And we need to stay on a medication. But it's not addiction then. It's bringing it back to the normal level. It's not looking for a high. It's not looking for something to change reality. It brings us to reality.
And I think this differentiation is what you need to have a very balanced approach. I would say, let's say if I'm a client as well, I need to research not what's going to help me on the internet, but what are the questions that I need to ask my clinician, my psychologist, my therapist, even if it's about therapy. Medication is one part. Even in therapy, sometimes what I do with my clients is bang in the first, let's say in the second session or so, I sit with them and I ask them, what do you want from this association going to be built and forming? What do you expect from me? And then the client comes up, what do you expect from the approaches? What sort of approach do you want? Do you want me to be a therapist who is going to be telling you, okay, this is what you need to do, pushy and whatever, or do you want me to just sit and just give you some prompts, or what style of
Therapy.
Communication and therapy do you want? And then we expose them to different therapies. And then I also have this point, what are you going to put on the table as a client so that this equation works in your best interest?
Of course.
So this expectation management is something that I would highly recommend, even like parents, adults, anyone walking up to a psychiatrist or a psychologist and having that conversation in a very, from a perspective that it's going to help both the parties find a solution that is sustainable. Because sustainability is something that we forget when we are either going more for medication or we're just saying, no, I don't want it. So we need to also see how sustainable
the changes are.
The changes are.
Right.
Yes.
So medication sometimes is needed for life. I don't want to miss that.
Yes.
But most of the time it's not needed for a lifetime, especially with kids. We try to get them off medication, and kids are very flexible in their bodies. We see that. They're also very flexible in their minds. They're always learning. They're used to learning because everything is new. Everything is new when they're born.
I totally agree with that. With kids, the flexibility comes in. I've had clients where they've been like teenagers diagnosed with ADHD and the parents don't want to go for medication.
Yeah.
And the teens are so open, clear, and they're like, I want to.
Yes.
I want to try this medication. I need this help because they're struggling, right? At the end of the day, it's the child, it's the teenager, it's the adult who's in that position. They know what they're suffering and what they're going through, and not the family.
Exactly. And I think the family has good intentions, but they don't necessarily know how the child is feeling.
Yes.
And sometimes the child or the teenager can't express it fully so that the family understands.
Yes.
That's part of the umbrella of advocacy.
Yes.
So we're saying it's a collaboration. How does a person advocate for themselves?
Yes.
How do we then advocate for the person too? Because sometimes we're the go-between, especially with our teens. They come in and they tell us all these things, and we have to think about, now, how do I explain this to the parents so that the parents can understand it? They mean, but it doesn't make sense.
Doesn't make sense.
We're just different humans, and the generation makes a difference too.
Yeah.
So part of my job, and I'm sure your job, is translator. We have to transliterate for people.
Yes, yes, absolutely.
What do you mean? What do you say?
What do you say?
Until they're comfortable. And one of my favorite things, especially with teens, is when we finally can get both the family and the teens in the room. Say what you want to say. Okay. What did you hear? Completely different.
Yeah.
Completely different.
We're sitting in the same room. We are listening to the same track.
Yes.
And you get this.
And then the families start to understand that, oh, wait, I'm listening, but I'm not actually internalizing. I'm not hearing what my loved one, and it's a teenager, they're saying things differently, but they care about them, they love them, and they try to understand them, but they're not understanding them. And then you have to do the opposite. Parents, what do you want to do? What's happening? How are you trying to protect your child? And the teenagers, they're just trying to control me or whatever it may be, because it's always a struggle. It's normal. It's healthy.
It's healthy,
But then when they understand, we translate and they get to communicate better, after a few weeks, things calm down. It's a wonderful thing for them to come in together and say, okay, we said this, we didn't understand each other, we reset it in a different way, and now we're on the same page. Nothing is 100%, but it's beautiful to see that connection.
Yeah. And what's flashing across my mind is all these stories that you're talking about. See, that reconnection is such an amazing thing.
Yeah.
When we talk about how family dynamics fuel anxiety, I think the disconnection is one of the most important factors in, not just for a child, I would say even for an adult, for a spouse, for a parent, for whatever reasons, the disconnection that is there in the family is because of various dynamics.
Sure, of
Let's
course.
delve into that. And again, going back to children, if I have to say, the overprotection, the control, okay, all this is there. How do we differentiate between a healthy parental environment versus a pattern that actually, let's say, becomes an initiator of anxiety and builds that risk over a period of time? Only when the adult walks into our session, let's say at 30, at 40, and they just come up and say, okay, I've got this burnout at work and I've got this. They're just looking at now. And as therapists, when we take the case study, we go behind, listen to their story, witness it, we realize, oh my God, this did not begin now at all. This is years ago.
It's been years in the making, of course,
years in the
right?
making.
And it is. It's just the way life is. And we would like to say we can prevent everything bad from happening in life, just to overgeneralize. We can't. But what we can do is try to stop more things from accumulating.
Exactly.
And so if we have an adult that's 30 and is coming in and saying, I have a lot of burnout, and that's a very hot topic these days, right?
Yes.
We look at what that burnout looks like for them. And do they have neurodivergence behind that? Because a lot of neurodivergence has a lot of anxiety associated with it because we're just different in the world. We don't know what's happening. The interpersonal dynamics are different. Then we look at what was the family unit like. Were they connected emotionally? Did they understand what emotional connection was? What did that look like? What degree of emotional connection was there? A lot of times the overprotective parent is because the parent is anxious.
Yeah, and they have a story as well. We're going to talk about the intergenerational trauma.
Of course.
We cannot miss that one.
Yes.
We cannot miss that one. Yeah.
So then we have to look at if we're already dealing with the adult, we help them understand where it came from. So that's called gaining insight.
Yes.
And then we help them understand what they want to do with what they know now.
Yes.
How can they adjust in themselves as adults to shift the way that they look at life, to shift the way that they interact. And it can be in various different ways, as you were speaking about earlier. There's different therapeutic interventions, but which one matches that adult as they go through that journey of healing, of recovery, of whatever you want to call it. But it's steps. It's a journey. It's not something that happens in 3 months or something like this.
Yes.
You start with 3 months. Awesome. After that, you have to explore more.
Yes, and this is exactly what I want the audiences to know when it is about mental health. It takes years. It takes time, basically, because what we've lived through, the nervous system has lived through.
Yes.
You cannot just grab a pill and get done with it. It's not so.
Work.
Anyone who is promising you these quick fixes, watch out. Because
quick fixes don't work.
Quick fixes don't work. Shortcuts don't work.
They don't.
So even with therapy, again, you have to. So what is therapy? Therapy is also about enabling or allowing people to learn to sit with their discomfort, is how I put it, in a safe container.
Yeah.
with the dynamics
Yes, absolutely, and work with their strengths.
and work with their
A
strengths.
lot of times they don't recognize the strengths. They're coming in feeling
Yes.
deflated.
There's
They're
no
coming in feeling
acknowledgement.
hopeless. Yes, when they're very powerful and they have a lot of assets that they just haven't used yet. They don't know how to enable themselves.
Absolutely.
And so helping them understand that and then sitting with the distress at the same time, they start to recognize that actually they're worth the effort, which is a
Right.
lot of times they don't
Right.
feel that they're worth the effort.
Yeah.
And that when they put in the effort, things do get better.
Dr. Sarah, I'm also curious to know what, according to you, in your entire career, you must have met so many parents and adults and all of it, of course. Can you come up with your take on the parents' personality and the types of personality that we have in parents, especially? You can also give examples if you want to, or any experience that you want to share that comes to your mind right now. Their personality shaping the emotional climate for the child, because and that's a very important thing. My personality is definitely going to be a very dominant factor
Of course.
in the kind of climate that I'm going to be giving my child.
Yes.
So would you like to shed a few?
And I'll expand
Experiencing.
upon that if you might.
Absolutely.
Right? So we think about personalities with the parents usually. We have to remember that typically there's parents, there's grandparents, there's aunts and uncles,
Yes,
there's teachers.
in our cultures, yes.
And especially in our cultures,
Especially.
everybody has permission to help raise the child.
It's a village.
It's a village. And the village has permission to almost, hopefully not completely, do whatever they think is right to help raise a child. If they see something that's good, they can praise them. If they see something bad, they discipline in their own way. And so I think part of our generational changes is understanding how to set boundaries for extended family
Yeah.
about what's okay and not okay in the way that they're parenting too, because they are parenting. So recognizing that, then recognizing they have teachers.
Yeah.
They have principals,
Yeah.
they have coaches, they have very extensive
Yeah.
adult circle in their life
Yeah, with whom they interact on a
with
day
whom
in and
they
day out
interact on a daily
basis.
basis. They also sometimes have older siblings, older cousins, younger cousins. So it really
It's-
does make a difference. If you see more of an anxious parent, and typically when you have an anxious parent, the extended family is more anxious too. And so when we have more anxious parents that are coming across to us as overprotective, for us, they look overprotective. For them, they're just doing the bare minimum to keep their child safe.
Yes. Yes.
So understanding that they're doing the best they can with what they have,
Yeah.
understanding that they're trying to do what they think is right. And for some kids, they actually need that kind of protection because they are impulsive, they can be very dangerous to themselves, and they may need that.
Yes.
For other kids, they don't need that. And actually, it goes into what we call neurosis. It becomes anxiety driven. So I think it's many personalities. And I've seen some really beautiful parents that are really doing an amazing job together as co-parenting, but also in their relationship. And they still have a child that has a lot of energy, has a lot of impulsivity.
Yeah.
They're doing, if you will, everything right, but the child is still anxious. The
Right.
child may be neurodivergent or may have something happening. So the parents and the community influence the child 100%. But it doesn't mean that it's the only thing that's influencing the child.
Very important. And that's the reason why I asked you this question, because I wanted you to highlight this, that most of us, when we see something good happening to a child or something bad, whatever, parents is the first thing that comes to our mind.
We blame
right?
and shame the parents, and mostly it's the mother.
Yes,
She
mostly
didn't
the
raise
mother.
them- she didn't raise them.
South Asian culture is, we're full of this. They
All
say
cultures.
that there's a proverb that goes, I won't be able to say that in Hindi, but it goes like this: if the child is doing well, it's the father. And if the child is not doing well, it's the mother.
Oh my goodness.
It's that harsh. And people use that. Till this date, I see educated people talk like that. So it's quite disappointing, I would say.
Yeah.
But yeah, you spoke about this personality, different types and stuff. I'm also curious to know, in our culture, when I have these adults also walking into therapy, I had this, a couple of years ago, I had this young adult, 35 years of age, married, has kids, all of it. Too much, of course, anxiety, depression, all of it. Intergenerational trauma,
Of
without
course.
a doubt.
Yeah.
And when we were sitting to talk for almost 10 to 15 session, all that this person opened up was, everything's great with my mom, dad. Everything's amazing with my mom,
I'm glad.
dad. Yes. And at a point, of course, through the therapy, they realize. And then once he just opened up and he said, no, but my dad did this. He used to always criticize me, and I can still hear his voice. Sometimes I wake up, I have nightmares even now.
Oh.
My dad beating me up and all
Yeah.
of that. And he said that and he cried. But what he said later broke my heart. The next thing that he said was, Nusrat, do you think I'm bitching about my parents? I shouldn't be bitching about my parents. And this belief as well is one of the major hindrances, even with teens, even today, if you
Yeah.
observe, to share.
It's a taboo,
It's a
right? You shouldn't
taboo.
speak ill of your parents. You should be
Yes.
respectful of your parents.
Yes.
And I think differentiating between if I'm actually like not being respectful is if I go into the community.
Yeah,
And my parents did this and my parents did that. And that's not useful.
absolutely.
If there's abuse and they need to get out, of course they need to tell people to get out, but choosing the right people to tell
Right.
also. In therapy, there's no such thing. In therapy, anything goes. We just speak about whatever we want because it's a safe space.
Yes.
And the conversation is for healing. It's
Yes.
not because we want to shame or blame or any such thing.
Yeah.
We want to understand where these things came from.
Yes.
Good intentions can still lead to poor outcomes.
Yes, yes. And the intention is to solve what you're struggling with, right?
Yeah.
To find a solution to the struggle
Exactly.
that is making you maybe dysfunctional,
Yes.
not allowing you to actualize your potential,
Yes.
isn't
Yeah.
it?
And it's an exploration. And we have to hold space for the idea that our parents are not gods. They're not perfect
And
and
this
never
is a
will
very
be.
important point that you mentioned, because again, in our cultures, no matter what, as adults as well, we do have this view or a
Yeah.
template that parents are perfect and we need to keep them on a pedestal. And so we expect highly from our parents as
Our
well,
parents and
not
ourselves.
allowing them to probably live their lives. It's like this chain of
Yes.
enmeshment continues from one generation to the other,
Yes.
and then the next generation is
Right.
locking in. And
Right.
it's like you're just passing the baton
Right.
mindlessly at times, unintentionally,
Unintentionally.
in most of the cases.
Yes. And I think that one of the things we can do is redefine respect.
Yes.
What does respect look like from generation to generation is different. And then as our parents age, it's also different. What they may have wanted or needed from us when they were younger is not the same as when they're older.
Yeah.
And if we hold them on this pedestal, it's also, as you were saying, very difficult for them.
Very difficult for the
to
parents.
ask for help.
Yes. Yes. How do you define respect? What do you think when it comes to, let's talk about today, how would you tell a teen that, okay, this is respect for parents?
I'd ask both parties
Okay.
and then find an in between.
Okay.
Because what parents think is respectful
Mm.
is usually not what teenagers consider respectful.
Yeah.
So we find an in between of what does this look like. And then you sometimes have the cool parents, if you will. And anything goes, but not really.
Mm.
Emotionally, they still feel disrespected.
Mm.
And emotionally, for the children too, if anything goes, that means that there's no boundaries, there's no containment. That doesn't feel safe. So respect is when they both feel safe in their interactions and they feel that they have that connection.
Yeah.
Whatever that may look like, and again, each child and each parent too are different.
Yeah.
Whatever that looks like is where we want to find that middle ground.
Connection is a very important, I would say, it's a pillar, it's a
is.
foundation in so many ways.
Yes.
And for parents as well, I would say that when you are struggling with anything or going with anything, maybe your own issues, the child, the family, or maybe your spouse is not being cooperative, because you have families like these.
Of course.
A majority of them, I would
It
say.
happens.
It happens. That's also a time that you can you can take that as an opportunity to connect with your kids in
Yes.
every challenge. And that's something that parents can actually learn, build
Yes.
their skills on,
Yes.
invest their time, invest
Yes.
their energy.
And it's worth it.
It's worth it.
It's so worth it. And we
it's so
always have to
worth it.
remember, if we don't connect with our kids, someone else will, and we don't know who that person will be.
When we talk about emotional invalidation that parents generally have, dismissiveness or that emotional invalidation, don't be silly. You're trying to minimize
Yeah.
what the child is going through. In India especially, I can talk about my country because the experience there is we have, of course, due to the generational trauma, we were colonized, let's not forget it. So how I see the parenting is, of course, we are shamed for the way we discipline our children. That's one way of looking at it. But when I've been, you can say, doing more of this decolonizing the psychology kind of approach and learning more about it, I realized this, that the parents, we are operating from the principle of scarcity. We were colonized. We did not have options. We did not have a lot of what you call as opportunities. So the only focus that most South Asian parents have, because these were all colonized lands in a way, our focus is we want our child to have the best, and discipline is the only way. Of course, the definition of discipline needs to be redefined
Of course.
without a doubt.
Yeah.
But that's how they are so like you can say, so demanding, and it's, come on, pick your stuff up, we need to walk a longer road.
Yes.
You can't be sitting and crying for that stubbed toe or a broken knee. We need to walk a long mile.
Yes.
So the emotional invalidation, especially in such cultures,
course.
is coming from this part.
Yeah.
How does that translate into anxiety, and what would you like to tell parents? How can parents be more mindful? Or
I think one of the most useful approaches is congratulating the parents on having the children that are so sensitive.
beautiful.
Right?
I love this. I wish there was some applause button. I love this, kind of made me, my nervous system just jumped. Wow, this is amazing.
Yeah, because the reason
What
that
a
they're
beautiful
having that
way.
struggle is that the children are safe.
Yeah.
They've taken their insecurities, their unsafe environments, and they've provided an environment for their child that is now safe. They feel so physically safe
Yeah.
that they can have these emotions and express them. The challenge now is that the parents don't know what to do with it.
Yeah.
It's this ping pong back and forth. I feel sad, I feel anxious. The parents were taught we have no time for anxiety or sadness because they practically
Yes,
did not.
They did not.
If you sat on the side of the road and you were sad and anxious, bad things can happen.
Yeah.
So you had to suck
Keep
it up, if you
moving.
will, and keep going. You had to be strong and keep moving. Being strong in one environment is not the same as another environment. So helping them really genuinely understand that they've really been successful, and these are the challenges of their success, helps the parents a little bit relax and understand that this is a new generation that we're challenging, and we're challenging them to do something more. Why did you do all of the things you've done for your child? And a lot of times it's around education. Why did we do all of these things to get them well educated and have their extracurricular activities? Because it's very practical a lot
Yeah.
of times for the
Yeah.
generations. Why? So they're successful. What does success mean now in their generation? I don't want them to be like, I get this a lot in the clinic, I don't want them to be just like willy-nilly, feel free, do whatever you want.
Yeah.
We're not that kind of parent.
Yeah.
I'm not asking them to be. We don't want to have unlimited everything either.
Yeah. Yeah.
Too much is
It's
too much.
bad. Yeah.
So what do we want? What do you want for your child? I just want them to be happy. How do we define happiness? And so just digging in both parties and seeing what we can do is very important. And then sometimes we actually reparent the parent, and they understand and they adjust. And it's a beautiful thing to see.
Reparenting the parent is actually, I would say, something that, can you elaborate on that? I do understand, and I do work on, of course, we all do work on the
Of course.
reparenting the parent, but our audiences need to know, why do we need to reparent the parent inside us?
And so what we do, all of us as humans, I think, so let's generalize it a little bit so they don't feel so stigmatized either here. When we're going through life and when we gain wisdom, right, that's us reparenting ourselves.
Yeah.
And as we learn things, we get to decide, do I want to take this in? Do I decide that this is something useful and beneficial to me? Or do I leave it aside? This in itself is reparenting ourselves. And when we think about older people, and we're just talking about how they have to be perfect, some older people never learn because they don't expand. They keep doing the same thing again and again. And they get to their 70s or 80s and they feel they're just completely disconnected. They feel that they're more likely to have depression and anxiety. They're more likely to have mental health disorders because they've never adjusted. They've never gained wisdom. They're not as flexible, if you will. So all of us want to gain wisdom. And when we help the parents reparent themselves, they're healing their inner child, or whatever word you want to use. When that happens, they can be more present. They have more to bring to the table for that connection work. So if we have a connection, everything else can flow.
Yeah.
If there's a disconnect, no matter what they do, nothing will change.
And when we talk about reparenting the parent, again, this work is something that happens on a long-term basis, and it's a work
Yes.
in progress.
Of course.
It's a work in progress. It's not something
It is.
that happens by writing a letter to your inner child.
I mean,
Again, the
you
quick
can write the
fixes.
letter.
Yeah, you can write the letter, but you
But it's
can't
not one
expect.
thing.
Yeah, it's not a one thing.
Yeah.
It's not a one-timer.
Yes.
That's exactly what we're trying to say.
Yeah, and the purpose of writing the letter, and I think it's important to recognize that too, is that it's a practice, it's a nevis. And when we try to reparent the parents, we can't necessarily do that in 1 or 2 sessions or even 5 or 10 sessions.
Yeah.
What we can do, the best thing we can do is teach them how to improve and increase their insight,
Yeah.
how to explore.
Yeah.
And so if I write a letter to my inner child and I hold space for them, that letter then becomes a book. It doesn't have to be written. It can be drawing. It can be movement. It can be whatever modality that
Yes.
person feels safe in. That lets them and gives them permission, if you will, to continue to do that for the rest of their life.
Yeah.
2 things happen. They feel better They feel more connection with people around them. They let go of connections that are not serving them. They get new connections that are hopefully serving them better. The child sees this too.
Yeah.
And then the connection between parent and child can change and hopefully improve. The child then avoids mistakes the parents had done.
Yeah.
So in that way, we're starting to change one generation. And research tells us to genuinely shift the trajectory of a community or a family is 3 generations.
Yeah.
So I teach, my child will teach theirs, and by then we'll see the
actual
changes.
Significant. Yeah, so we have to
Yes.
wait till generations. We're not
Patience.
even talking about, but definitely we can take this initiative to
Of
be
course.
the cycle breaker.
Of course.
That's
'Cause
exactly.
if we don't
Someone
start-
needs to start.
Yes.
Someone
Yes.
needs to start.
Yeah.
So amazing. I'm just processing what you're saying, and it's so beautiful.
Thank you.
I want to also highlight the high conflict environments that kids unfortunately go through. One thing that I find common between you and I is the advocacy of safe childhoods.
Of course.
And I think that's very important. And I'm
It
a
is.
diehard fan of. My heart breaks when I see the custody battles and how the kids go through. 6-year-olds, 7-year-olds coming in saying that, what are these adults doing?
Yes.
And it literally, that's the most difficult population in terms of, I can never go home and just say, okay, fine, I finished my day. These children, they just stick.
They linger.
They
do.
linger, and you're thinking, what's
Of
happening to
course.
them, and all of it. And they're such beautiful souls.
Yes.
So high conflict environments, and I believe, of course, it's actually the adult's responsibility, no matter what, who's right and who's wrong.
Yes.
Ideally, it's the adult's responsibility
Yes.
in that equation to ensure the safety.
Of course.
And by safety, again, let's redefine safety for the audiences. Safety is not just about the food, shelter, and the bare minimum that you're doing for your children. The most important thing is also the emotional safety,
Yes.
and that is the most neglected,
Yes.
underrated, especially in the high
Yes.
conflict, this thing.
Yes.
So what are the long-term impacts of a high conflict family environment where you have 2 adults, the parents, of course, disagreeing with each other, screaming matches, domestic violence? There's so many elements and so many layers to it. How do you think that impacts the long term of this child?
So we have adverse childhood event study.
Yes, the
that
ACEs.
The ACEs. So that explains to us the long-term effects, physical and psychological, with substance abuse. So we know it. We don't even have to guess at it. They're more likely to have depression and anxiety. They're more likely to have psychosis or schizophrenia. They're more likely to be involved in substance abuse and crime. They're more likely to be less productive and less successful at school, and then less successful at their jobs. They're much more likely to be in high conflict relationships themselves, either getting divorced or staying in those relationships a lot of times.
Toxic relationships.
The
yes.
toxic relationships, because this is familiar to them.
Yeah.
And so if this is familiar, although it's not safe, it feels safe, their body tricks them into feeling like this is normal when it's not.
Yeah.
And so the best thing we can do for our kids is stop the high conflict relationship. That means going to therapy. That means getting a divorce. That means even after the divorce going to therapy and figuring things out. If it means that we have to do separate therapy or whatever it may mean.
Co-parenting therapy. and all of that.
Co-parenting. Sometimes we have to remove, because some parents are just really toxic. So if they can't be in the environment with the child, we need to not have that parent in the child's life. This idea of, and typically it's the dad, unfortunately, they're saying that they have to have a dad. Having an unhealthy dad in that relationship
Yes.
is worse than having no biological dad and then finding males that are healthy and safe for them, that can hold that ego strength for the child.
Yeah.
So they can still have good male experiences and advocates, because that's what a parent is
Yeah.
supposed to do.
Yeah.
We're supposed to advocate for our children. They can be advocates, they can be role models, in healthy teachers, healthy coaches. There are good men out there. We just have to find them and make sure that we're safe around
We
them.
also need to raise them, Dr. Sarah.
We
now.
have to raise our
We
boys
have
to be
to.
men.
Yes, we have to. We have to. That's again one work that is so close to my heart.
Yes.
Raising responsible boys.
Yes.
And times are changing. The way women are venturing out, the freedom, things are changing.
Of course.
So I would also go to this lens to say it's not just removing the toxic parent, whether it's the father
the mother or the grandmother.
or the grandmother, any caregiver
Yes.
who is playing that toxic
Yes.
role in that moment.
Yes.
uh,
A lot of
is-
times it's personality disorders, which
It's
are really
pers-
hard to heal.
Yeah.
And if they're not safe, for example, if this was a person that was a stranger, would I allow this person around my child? If the answer is no, it's still a no.
Yeah.
Yeah.
So the blood relation should not be a marker or the ground for you to keep your child into that high conflict zone. And then there are all these apprehensions that clients have, right? What will I answer my child when they grow up that I denied the father the custody or I denied the mother the custody? How am I going to answer that? And I think that's where, when you said even after your divorce, therapy is important
Of
then,
course.
right? That'll
Yes.
help you to navigate all these
Yes.
questions.
Absolutely.
Doesn't that make sense?
And
Yeah.
I think it's important to note that if the other person is willing to get into therapy and willing to do the work, there's a door that's open.
So I want to ask about the gender. Do you see how boys manifest anxiety in high conflict families versus girls? What is the difference, or is there any difference in the way they manifest anxiety?
It's changing. So
Okay.
we used to think about boys being more behaviorally externalizing
Yes.
and girls
Internalizing.
which means that boys will go bite and kick and scream and shout,
Aggressiveness,
and girls will
yeah.
get depressed and anxious.
Yeah.
We're seeing that shift, and we're seeing more externalization. So girls are feeling, because of the culture and social media, they're feeling more physical and they're feeling more empowered physically. So they're biting and screaming and shouting too.
Okay.
And we're seeing a little more sensitive side to the boys. So we're seeing the anxiety and depression also be diagnosed, whereas before it was missed a lot of times.
Yeah.
So it shifts, it changes. There's no gender difference 100% across the board. It just depends on the temperament of the child.
And again, the
what-
environment
and the environment that they're in.
channels that they get to talk about it or know.
Exactly.
Okay, so when we talk about the intergenerational patterns, especially in our region, what are the myths about parenting that fuel anxiety?
So many.
Yeah.
So many. What are the myths that the parents have? I think one of the ones that they commonly come in with is that we're not anxious at home. I don't know why this kiddo is anxious. Why is she not talking? And why isn't she like her cousins? This is one of the most common things I
The
see.
comparison, oh my God,
Right?
yeah.
Yeah. And then they'll say, I'm not comparing. But why isn't
There's a
she like her
disclaimer there.
cousins? Right?
Yes.
And so we start to explain things. And we, in the region especially, there's examples I can use because of the religion. It's a very common religion, is Islam.
Yeah.
And so if we talk about Islam, we talk about the Prophet ﷺ, and he had 4 khalifas.
Yeah.
5 very good examples of men that have very different temperaments. And each of them was a leader.
Yeah.
And then the Prophet's wives, very different temperaments. But again, they were considered leaders in their communities.
Absolutely.
So we just look at it as this is a myth of if I'm this way, my child has to be this way. You're this way because you're a personality. Your child is this way because they're a different person. They're a different personality.
Yeah.
Whatever you do doesn't mean that it'll translate to the child. They'll take what they can and they'll not be able to accept what they can't. So coming at it from a perspective of expectations need to shift. It just
Right.
is what it is. It's so cliche, but it genuinely is what it is. Now what do we do with it?
And again, insight is the most important thing.
Insight, psychoeducation and
Awareness, yes.
insight. 60%, we were just having our clinical meeting and we were talking
Yeah,
about
yeah, yeah.
60% of our work is psychoeducation.
Psychoeducation.
And psychoeducation is us to the person and their
Right.
family, but part of that is us understanding the family and the person.
Yes.
We have to sit with humility and
Right.
humbleness to understand where they're coming from, what their culture is within that family unit.
Yes.
Because we can understand a culture generally, but within the family,
Within a
cultures are
family,
different.
yes, because every family is going to have a different ethos, a different
Yes.
culture.
Absolutely.
And then to be able to define that and then start the work is, I think that's definitely the
Yes.
way to go about it.
Yes.
And it's also important for us as families to sit and talk and understand, okay, what sort of, what I recommend to parents, what I do in my family, I can just talk about myself. We have this time that we spend, let's say, on an annual basis, where we literally sit and we say, okay, are we okay with what happened in the last year?
I love
with
that.
my role, with your role. And we have involved since my son was 5, we've been involving him. So we involve the youngest member as well,
Of
where we
course.
say, okay, fine, what do you think? What do you think? Where should mama improve? It's like a feedback session. It's like a very insightful session. And trust me, we often dismiss kids saying that they don't understand, or they don't realize or whatever. But they do.
Very much.
They do. And the feedback that you get, if you just are open to it and if you listen to it, and then we also get an opportunity to put down our expectations.
Of course.
So we just do this thing where we say, okay, let's make 3 columns. What are we going to stop?
I love that.
What are we going to start? And what are we going to continue?
Yes.
So we do
Yes.
that for individual stuff. So I believe most of us, as when we're talking about family time with the social media, again, another one of the reasons why I would not blame the social media or the internet, honestly speaking. It is as much as, again, how families are allowing the use and
Of
what
course.
rules we have,
Of course.
what values we have around the usage
course.
is one of the factors.
Yes.
So spending that time with each other, connecting, listening, being open to feedback, and giving our kids the space to speak, I think, is something that would definitely help.
It does, absolutely. I agree 100%. And it doesn't always come as negative feedback. I think a lot of parents are afraid if they open that discussion
Yeah.
to their kids, they'll say something not
Right.
nice. So many times they're surprised by, I feel very loved by my
I
my
feel
father,
safe.
my mother. I
Yeah.
feel safe. Little kids will be like, I love it when they give me candy. It's not
Oh.
just because of the candy. What does the candy mean to them?
Yes, and
right?
they're going to remember this memory for a lifetime.
They remember how they felt.
Yeah.
And a lot of us have a lot of associations with food and our grandparents.
Absolutely.
It's not the food, it's the emotion that was
The
connected
emotion
to it.
and the effort that was
The
taken
effort
by
that
my
was put
grandma
into it.
to,
Yes.
to cook and to, cooking is one thing. Yeah, I love cooking. Just realize that. But yes, a very important aspect is about the way families are spending time these days.
Yes.
What would you like to, I would not use the word advise, I would like to say, what do you suggest? How can parents, it's a fast-paced world. We have
It
double
is.
incomes, all of that. We have single parents.
Yes.
We have parents who are struggling financially. There are so
Mhm.
many things.
Mhm.
But how do you think parents can spend more time? Because spending time is also one of the major, you can say, contributors to the emotional health.
Of course.
Quality time, of course.
Yes, of
Okay,
course.
by
Of course.
definition. What would you want to say
Yeah.
about that?
So I'd say one of the first things we want to look at is the parents taking care of themselves.
Wow. Yeah.
You can't pour from an empty cup. So if you're sitting there and you want to be present, but you're drained, you haven't slept, you haven't eaten, you're still holding your bathroom since you came back from work because you want to be present with your child.
Yeah.
You're thinking about the bedtime routine and what I need to do. If you have a teenager, did they do their homework? Did they do this? What am I planning for tomorrow? What am I going to have for breakfast tomorrow?
Yes.
All of these things happen. It's normal, right? If we take a little bit of time,
Step
and it
back,
can be
pause.
step back, pause. And that looks different for everybody. And some days it looks different than other days. Some days I need to be more active. I need to do something that's moving my body. Sometimes I need to be calm. But take that pause if they can, and I'm saying if they can because some days we just can't. And forgiving ourselves for those days that we can't because life is difficult.
Yeah.
Pause. Figure out how we're feeling. Eat, drink, go to the bathroom, basic things. Go take 5 minutes just to meditate, to pray, to just sit with silence, to,
Yeah.
even if it's playing on, some persons regulate by playing on their phone. These mindless games, set a timer so we're not sitting here for 2 hours, 2 to 3
Right.
hours.
Yeah.
But do something that helps you
To reset your nervous system.
reset.
Yeah.
Then when you're reset, you can actually come and bring something to the table with the child.
Yes.
But if you're just sitting there and everybody's sitting and they're watching TV or they're on their phones or they're watching TV and their computers and the phones, sometimes you see that in families, and but we're together.
Yeah.
We are together, but are we connected? Do I know what their favorite color is? Basic things. Do I know what their favorite food is? And if you ask, your favorite food was whatever it may be. Oh no, that was last year.
Yeah.
It's these moments of understanding. It's these moments of connection. It's not this big chunks of time that you have to set aside every day.
Very important. Yes.
Very small things.
Small chunks.
Yeah. And just knowing, remembering you love each other.
Yeah.
How do we show that?
Yeah, and I think it's also important to communicate. Like when you said, I know that there are so many single moms who rush home at night and the child is wanting to hug them, so they hug the child. And I've always advised these parents that, you know what, just step back. The way you said self-care, step
Yeah.
back, pause. And when you have, let's say on a Saturday, I have some time, I can sit with my child and explain the next 3 weeks, it's going to be very hectic. So
Yes.
giving them an idea about how your schedule
Yes.
looks like. And kids cooperate. They're very
They do.
kind.
Yeah.
They're very kind. They get you the glass of water. They're like, okay, mama, are you okay? Do you need a massage? Do you need to just sit and talk? So communication is also one way of allowing our kids to know that, yes, my
Yes.
mom also needs to step back. My dad needs to step back at times.
course.
And it's okay. It's
It's
okay
good.
if someone steps back because they need that time to
Yes.
regulate themselves
It's
rather than
actually
just...
good. It's not just okay. I want to
Yes.
emphasize that too.
Yeah.
Because then we're helping them understand that we're not gods. We're not perfect. We acknowledge that we're not perfect and we will make mistakes. And when we make those mistakes or when we're imperfect in our interactions, it doesn't mean that's the way we are. It's a
Right.
behavior. It's something we
Right.
want to adjust. Usually there's no intention for that to happen. So stepping back teaches them that we're imperfect, and it teaches them that they can be imperfect too. And they can take a step back with their relationship with us until they're ready to come into it, with their relationships later in life, with their friendships, with their romantic relationships, at work. We're modeling what healthy self-care looks like.
Exactly.
And the typical thing of do as I say, not as I do, needs to be erased.
Erased completely, bang on. So I think we've covered most of the points here, but there's one thing that I want to talk about as clinicians. What is how do you see this? Because I personally believe that there has to be a multidisciplinary approach when it comes to client care, or even when we are probably caring for the collaborative care. So how important is it to involve families into the recovery process?
It depends. And that's one of something that's near and dear to my heart. Instead of using multidisciplinary teams, we use something called transdisciplinary teams. In a transdisciplinary approach, in general, it means that we all have our specialties and our trainings, but I understand more what you do, you understand more what I do, and each of the team members has some of that, so that when we're speaking to our clients, our patients, to our families, we're all saying the same thing, and we understand what the next person will do.
Yeah.
So it's a community that's then helping a community. The same thing holds true with families.
Yes.
If we all are sitting there saying, I'm right, you're wrong, do what I'm saying, you don't understand, you're old, you don't understand, you're young, there's no communication, there's no connection.
No communication.
So I think it's vital, honestly, it's vital to take a look at what's happening with the families and then decide who are the safe people in a family. And we don't always have to involve all the members of the family.
Very important, yeah.
We have to be very selective about who's able to help that person heal. Sometimes there are toxic people in a family. The people we see at work that are not so healthy, they have families.
Yeah.
And it's not necessary that they're good with their families. We don't know. Our job is to advocate for healthy people.
Absolutely. And that's why this transdisciplinary, multidisciplinary really helps. And just, that's what I'm trying to say, that just isolating. So parents generally, again, or adults as well, they feel, okay, I'm going to a psychiatrist, I'm going to a psychologist. My work is done. And I see so many of them, I think you need to meet an endocrinologist, because what you're going through, there's a lot of hormonal imbalance that I can see.
Yeah.
And then we have this approach of, okay, talking to, of course, we work, the way you said, transdisciplinary. So we have our set of team or people that we work with, or a nutritionist, or sometimes even the teachers especially. Very important, isn't it? Very important. Yeah. So that is something that needs to be really taken care of.
It does.
And I think we've almost touched all the points. Anything that you would want to bring up in terms of how families are fueling anxiety? And
I think just being humble and patient with ourselves too as families, and understanding that not everything that's wrong is wrong. We can sometimes look at those things and think about what are the strengths within that we can help cultivate for this child so that they feel more secure in themselves.
Yeah.
Always be open to learning new things. This is part of gaining wisdom. There's nothing wrong with it.
Yeah. Perfect. Now we have a dose of reality, which is the rapid fire round. You can choose to answer, or you can choose not to answer.
No worries, absolutely.
Okay. One misunderstood diagnosis in child psychiatry.
One, behavioral changes.
Behavioral changes? Wow. Okay.
Because so much more is behind it.
So much more is behind it. Any case or any first in your learning experience when you began your career that stayed with you?
Oh, a beautiful one, actually. Can I tell a small story?
Of course, we have the time.
And I have permission from him to share this. So it was somebody that had gone to jail for murder. And he was very much a man's man, if you will. And he came to me, and the first thing he said to me is he was seeing a psychologist that was a male, very buff. The guy's buff, the psychologist was buff, so it was a good fit. They were connecting. He comes to him and he says, listen, you're a woman, but this guy said you're good. Thank you. Okay. So we tried to explore why he's there. And he came to mental health in general because he had a 12-year-old boy, and he had gone to jail for murder because he was protecting his friends, and he didn't have parents that were protective, and the friends didn't. So this came from a place, unfortunately the result was bad, but it came from a place of very kind protectiveness. And he started to see some behaviors in his child that were similar to him, and he said, my child can't turn out like me. That will never leave me. And he was one of the kindest, most beautiful people I've ever met.
The enlightenment, right? And I think these patterns, once you see that there is a pattern that's happening and that's not helpful, I think that's the time when you should seek help, or at least sit back, pause, and reflect.
Yes.
That there's something I'm doing on a repeated basis that's causing the pattern, and what is it?
Yes. and you don't know what it is.
And
So
you
he
don't
was
know.
able to go to somebody and say, I don't know what's happening. We need to change.
Wow, wow, amazing,
Yeah.
amazing. Yeah, and what helps you to stay grounded after a tough week?
Nature, especially in Dubai. I typically like cold weather, but
Of course, all of us.
I know, right? Because you have the opposite. But being outside in warmth is very grounding. Being able to, for me specifically, taking off shoes, just feeling that warmth, feeling the grass or the nature around me is very grounding. And just taking a few minutes just to breathe,
Yeah, breathe.
and just be, not think about anything, just be.
Amazing. One parenting mistake that we all make, but we barely notice it.
We overjudge ourselves.
Wow, good one.
Thank
What would you tell a new psychiatrist or a psychologist who's beginning their career? What message would you like to give them?
Everybody has imposter syndrome. It's
Oh.
okay.
Yeah.
It's normal. It means you're trying to do a good job.
Yes.
Yeah.
Okay. And your idea of self-care?
It changes depending on the mood. So sometimes self-care can be act, sometimes self-care can be quiet. Just depends on what's happening in the moment and that day.
Wow. Now we're going to sign off with one last segment, that is the closing takeaways. Can you tell our audiences or suggest a question that they need to ask their child every week, at least once a week?
I'll do a little bit of a challenge, okay? Because I always think about people have their strengths within them. We want to bring them out. So I'd say ask your child, what do you want me to ask you this week? Or what would you like to speak about this week?
Okay, that's interesting. It
Because
gives
then
a
you're
lot-
engaging them.
Yes, yes.
And then they think.
Yeah,
And then there's a connection. In that, there's a curiosity that's already been created.
yeah. Amazing. One habit that a family can aspire to have that would perhaps help them with the anxiety or lower the anxiety in the climate, not in people, but in the climate, because
Recognizing that there is always going to be a genetic predisposition to anxiety. We've inherited it, and it's okay. When you feel the anxiety coming on, recognize that it's there and just do something to help it be contained.
Okay, okay. So this is something that we are signing off with, but before we sign off, we have a section of Ask Your Host. You can ask me any question, not necessary that you ask with respect to this topic, but
Ask
Okay.
anything.
ask anything.
Surprise! Where do you see the community work that you're doing and that you're building with in 10 years?
Inshallah, I like the community work that I do with Cactus is the core of my being, my passion. 10 years from now, I see it more, you can say, spreading this message or expanding the community, not just from the small town or the country that I'm operating from. It's not in terms of scalability, it's in terms of creating that connection where the roots will be India,
Yeah.
but people across the globe will
Yeah.
be able to connect to it, will be able to, they already do in many ways because we run this support group for survivors and stuff, so we do. But more than that, we are now looking for the next 10 years with the next generation taking ahead or probably taking the baton ahead is we want to create more replicas of the way we have shaped the community because it's a beautiful community
love
out
that.
there. So we create these replicas in different, of course, customized replicas again.
Of course.
It's not like a template, but
Yeah.
where we want young voices, where we want children to be heard. We want, so you never know, after 10 years, the community might just be run by 10-year-olds or 12-year-olds. That's how we actually see it. Because we don't want it to be adult-led. We want it to be children-led. Because most of the things that has to do with children, we do not consider their voices. It's the tokenism that's there. Okay, you have one kid
I see what
representing
you're
the
saying.
UN, giving a speech,
Right.
beyond giving the speeches. So the next 10 years, the way we have a long-term vision is for kids to overtake this and say, okay, we are now going to talk to adults. We are now going to talk to the policymakers in a way that suits us, because then you're building the next generation. And I think we need to focus more on the next generation than what we had in the past or what we have now. So that is how we see our community expanding or building brick by brick,
Yeah.
is a lot of young voices.
Yeah.
A lot
So their
of young
voices are more heard and more sustainable.
They need to, because
Yeah.
what's happening with children now, they don't
They're
have
silenced.
a say.
They're silenced a lot.
And they don't have a say in families. They don't have a say in their schools. They don't have a say in the communities. and they don't have a say in the state level politics or any which way. They don't have a say. That needs to change, I feel.
Yeah, that's beautiful.
Yeah.
Thank you.
Thank you so much, Dr. Sarah, for being here.
Thank you for
It
the
was an
invitation.
honor and a pleasure, a privilege, I would say, to have you here.
Thank you.
And to know you personally is, again...
I feel the same.
Thank you so much.
I appreciate
So
it.
this was one episode where both of us had this conversation. Dr. Sarah came up with such beautiful insights, and I love the way Dr. Sarah has empathized with the parents. So we did not bash the parents as was expected. Never bash the parents, because we are all humans. And what I take away with me with this episode is the idea of self-care, stepping back, finding my own patterns, trying to be in tune with my own truths before I set out to say, I want to change the way my family works, and I want to be the rebel in my family. So how can I work on myself? And I think if every family members, we inspire each other to work on ourselves, there's a lot of change that we can say. And don't forget what Dr. Sarah just mentioned, that for the real change to be really visible, we will need 3 generations. So have patience, have faith in your own story, have faith in your own strengths, and you will be able to carry the invisible backpack that you have on your back in terms of the intergenerational trauma. But you know that you have so many options, whether it is medicine, whether it is therapy, whether it is a community, where you can just about offload your backpack, keep what is essential for you, throw away what is not. And so thank you so much.
Can I just add?
Go ahead, please.
Because that backpack has the intergenerational trauma, but it also has the intergenerational resilience.
Lovely. Intergenerational resilience. And yes, I think especially the way we think about a family going through something, we also need to realize that sometimes even the previous generation, we see you can say, the way they snap at us, their anger, resentment, all of it. But I think as for youngsters and for the next generation, it's also important to see the resilience, because there's a lot that the previous generations have gone through, especially in this region, especially in the South Asian bloc. The global South is how I would like to put it. We're still going through a lot. So don't discount the resilience that is in our DNA.
Yes.
Right?
Absolutely.
So we need the backpack, but we'll see as and when it goes. So thank you so much for watching this. Please share this with your family, your friends, and anything and anyone you think, this might be helpful. If you want to get in touch with me, or if you want to get in touch with Dr. Sarah, you can inbox us, and we will definitely pass on the contacts in case if you want to continue or connect with them for any purpose. Thank you so much. Thank you, Dr. Sarah.
I appreciate it. Thank you, too.